We'll look at it with the reverse angle one more time, and I suggest is weak.
Oh, look at that right lower leg. Oh, it's not supposed to bend that way. Spine-crushing tackles, knees bending in ways they never should, and one wrong step ending an entire season. In honor of the big game, today we're breaking down and reacting to some of the most brutal, career-altering injuries in American football history. Let's dive right in.
On 2nd and 5, plenty of time for Dalton. They're short of the first down.
Oh, he's grabbing his back. My back! Just injured his cervical spine. He did this because he had an axial load hitting the top of his head down into his spine. He actually had a spinal contusion. That means basically a bruise. A bruised spinal cord is not a good thing. It is swollen, it's irritated, there could be blood in this area. It's gonna interfere with the nerves.
Went in there with his head down, and that's never a good thing.
What we'll typically do is first getting a CT scan of somebody's neck. Look at that neck! Make sure that there's no fracture, but then if the patient is still very symptomatic relating to a neurologic exam, we need to get MRIs.
3rd and 10. Trubisky to the end zone. Touchdown!
Oh, that tibia just drove itself backwards on the femur itself, causing a dislocation, which then goes backwards. Putting a knee back in isn't really the most difficult thing to do. The femur is so smooth and round, you can even see the knee looks abnormal at that point.
This catch, left hand, holding the ball. Still securing the ball.
Oh, that's flopping around. All the major blood vessels are running behind the knee in what's called the popliteal fossa. In that area, you have your popliteal vein and artery. The most concerning thing is, did we injure the popliteal artery?
Mitchell Trubisky trusts Zach Miller as he goes up and brings it in. One hand. And what happens
is there it is. Oh,
the
gosh, that hurts. Woo. What we'll end up doing is examining the patient as is, seeing if the pulses are good or not. If we have any concern about vascular injury in that area, we need to do a CT angiogram of that leg. If there is an injury to that, you're not going to get appropriate arterial blood flow, aka oxygen, to your distal tissue, which can then turn into ischemic tissue, and you can have a dead lower leg. Oh my gosh, I love this old school. Whoa. Ow, it just got crunched. Open tib fib fracture that was documented as a compound fracture. If you've watched my channel many times, I like to correct that terminology. We use comminuted in the medical world.
We'll look at it with the reverse angle one more time, and I suggest
oh, look at that right lower leg. Oh, it's not supposed to bend that way. An open, comminuted, displaced tib fib fracture. Open means that the bones have come out of the skin or pierced through the skin. Why do we need to know that? Because the bones have now been exposed to the outside world, increasing the risk of infection. As ER doctors, we will typically start a prophylactic dose of antibiotics in the emergency department.
Good things here in this game. Here's Chubb trying to pick his way inside the 5.
Oh, it didn't look so bad, but let's see some, that left knee, no good. He ended up having multiple ligamentous injuries to that knee. It usually is a terrible triad when you're getting hit on the lateral or outside aspect of the knee. Usually the ligaments that are affected are your ACL and your MCL.
Protection breaks down and time runs out. Down goes Rodgers and the sack for Leonard Floyd.
Rupturing your Achilles tendon, different things can make it weak. If you're already sick, if you're on certain medications, it can actually cause an increased risk of tendinopathies and ruptures. It's usually a forced movement real quick.
Take a look here at the very end, and hard to...
If it's completely ruptured or even partially ruptured, you're going to have trouble pushing off because now you don't have any calf muscle attachment. Your calf, the nice heart-shaped calf, that's your gastrocnemius, and the soleus sitting underneath, helps with explosion off. It's not intact anymore, so you're not going to be able to do that. You'll be able to walk on your leg, but you're not going to be able to push off.
Here's a little better look as far as what might have happened for him to go back
right
down
there.
the ground.
Yep. When somebody comes into the emergency department, we'll lay somebody off the table and have their foot dangle. You squeeze the calf muscle, your foot should go up. If it doesn't, it's not attached. It just trips and falls.
Watch as he goes to the ground. It looks like that. Oh, the left knee.
Yep, you saw it.
It almost hyperextends, like it straightens out as it hits into the ground.
Ooh.
Watch this next step. The left knee right here.
Oh, went the wrong direction. These take a long time, maybe 3 to 6 months of really good healing rehab after you have surgery to get back into it. Knee's going to swell up. You're going to be bedridden for a little bit, struggling for a little bit, lots of ice to the knee. That's what the orthopedic surgeons like.
Dirty is coordinated. Good move by Daniels to get away from the first.
Oh, that arm went the wrong direction. And it goes behind. Always got to be careful. Our bodies do this, put our arms out to stretch, to brace ourselves, but injuries typically occur to our limbs when this happens. We get a lot of wrist fractures, and here you have a dislocated arm.
Daniels got tangled and the arm just gets pinned.
These are actually pretty easy to put back in. There's 2 different types of techniques, basically. You can do it laying on your back. You can do it laying on your stomach. The sooner, the better, because once it starts to swell a lot, the swelling is what gets in the way of trying to put this back in. Right there. Oh, whole body. Douche.
Right into the turf.
Frank Clark.
Ouch. When somebody gets a concussion, basically like a brain bruise. Sometimes you can do observations. Sometimes you might want to get a CT scan. If there's any loss of consciousness, profuse vomiting or nausea or abnormal behavior, you're going to get a CT scan of the head because you want to make sure that there's no head bleed.
Wilson landed awkwardly right there. He got hit initially and then went down very hard.
People come to the emergency department often relating to concussions. We will do our neuro assessment and then discuss imaging or not. Every case is different. Age population also plays a significant role.
Very well, and then the run game has been non-existent.
Oh, helmet on helmet, so bad. Watching injuries like this is a reminder that deep restorative sleep is when your body repairs muscles, tissues, and even hormones that support healing. That's why we created Do Not Disturb to help your body actually rest and recover overnight. Check out Do Not Disturb at lifehappens.com or on Amazon.
Enough to ding a receiver.
Boof.
Hit right there and then see his face into
So
the ground.
Gibson's
would
okay.
hurt even more. He is defenseless.
You're not ready.
Did get 2 steps, and then there's the hit.
Definitely compression, axial load, spinal cord injury. He ended up getting a contusion to the spinal cord, had numbness and weakness to the lower extremities, I believe, which is scary.
Pass is incomplete.
Oh.
And no flag is thrown.
Oh, the defender. He ended up injuring the ACL and the PCL. Your stability within the inside of the knee, attaching the femur to the tibia on an X like this. They crossed. No connection for anterior and posterior movement, and you're holding on by much smaller ligaments on either side.
They're in man coverage underneath, and there's certainly the right hand was on the shoulder.
Whoa. Once it ruptures, it's a lot of pain, and then usually you're okay, Mostly. But then it's the swelling, and the swelling causes a lot of discomfort. Rehab is a long time because you have to make sure that both ligaments are attached appropriately. American football injuries, not for the faint of heart, but you can see it's usually relating to your head or your joints. Those are the big injuries that we end up seeing. Occasionally, you see a pretty nasty fracture. If you guys enjoyed this, definitely check out this playlist right here. Binge watch everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.